Welcome everybody to the Vitalyst Health Foundation Grant Information Session, and happy September the 1st. I cannot believe it's September already, but here we are. I am going to figure out how to advance the screen. A couple of housekeeping as we get started. This webinar is being recorded so that we may save it and post it on our website, which will be at vitalysthealth.org/grants. All of your lines have been muted upon entering the webinar, but please use that Zoom chat room function to ask questions throughout the webinar. I have a couple of my colleagues on that will be helping facilitate questions as they arise, and we'll be taking short breaks as the webinar progresses. These slides will be in a PDF form and the recording posted to our website by the end of this week. So thank you so much for joining us again. My name is David Martinez. I'm the Director of Community Engagement for Vitalyst Health Foundation. The grants effort at Vitalyst is definitely a team effort. We have a growing team of about a dozen or so folks led by our President and CEO, Suzanne Feaster. And I am in a newly expanded role here at Vitalyst. I know many of you through capacity building efforts and also our civic health portfolio at Vitalyst. But we've gone through a summer of transition, if you will. Many of you know Melanie Mitros, our former Director of Community Partnerships, who facilitated and really laid the foundation for the grants program here at Vitalyst Health Foundation. She has moved back to her hometown of Alabama, but thankfully, I have her, and we as an organization still have her in a consulting role for data management and back office support. She's joining us today for a little bit of moral support for me, so I'm really thankful for her and to answer questions that I may not be able to, since I'm still wrapping my head around our great resources that we're offering to Arizona nonprofits and collaboratives. So thank you so much, Melanie, for joining us. And Kelsey Otten is our newly titled Assistant Director for Partner Engagement, and she's also online helping with the Zoom logistics and operations. And she's in a new role to help, especially our TAP AZ fiscal sponsorship program, our capacity building, and she's helping in the interim with our grants contacts as well. So we'll be sharing our contact information at the end of the webinar because we definitely want to stay connected with you. But this is the Vitalyst Grants team. Many of you know Vitalyst Health Foundation, but I thought I'd get a start just as an education in 101. For those who have lived in the Phoenix metropolitan area, you might be familiar with the St. Luke's Hospital System. They were started as a nonprofit hospital that sold in the mid-90s and to a for-profit company. And the sale of that hospital started what was then called the St. Luke's Charitable Health Trust. An endowment was started that provided grant making in the health space. And a couple of years after that, in the 2000s, the name and branding changed to St. Luke's Health Initiatives, which many folks are familiar with. And a few years ago, we changed our name to Vitalyst Health Foundation, which is obviously our name now. And with the evolution of that branding came the evolution of our efforts as well. We see health as more than just healthcare, but our mission is still to be rooted and connected to support and inform efforts that improve the health of individuals and communities here in Arizona. So we are rooted in key values, and those are empathy, equity, integrity, openness, and shared knowledge. And you see a lot of those values put into practice through our grant cycle, especially the equity piece, which we'll be talking a little bit more about, and openness. We are very accessible as a foundation, and we'll share opportunities for you to stay connected and learn more about our grants efforts as well. You might be familiar as in the nonprofit sector with a theory of change. We like to call that those are ingredients for change. The policy, systems, and environmental change will definitely lean into as part of our systems change grants. It's a little bit of a different type of thinking as opposed to direct service or more programmatic work. So we'll definitely get into that. We, of course, want to shift the health paradigm and show that health is more than just healthcare. So we'll take a little bit of a deeper dive into that as well. The systems change and Spark grants that we offer are meant for collaborative partnerships that are multi-sector. So we'll take a little bit of a deeper dive into that as well. And of course, these have to be community-driven solutions that build trust with community and hold that equity lens that, again, I'll touch base on as well. That's all encapsulated in our vision that all individuals and communities in Arizona are healthy and resilient. And you can learn more about our strategic roadmap on our website, and that website is linked there on this slide. As I mentioned, we see health as more than just healthcare, and we put into practice that vision and mission with those values and ingredients for change through 5 programmatic goal areas. So we definitely see that access to care and coverage is still a key and pivotal effort to ensure the health and resiliency of Arizonans. You can't be healthy if you don't have healthcare insurance. And we have an entire effort that builds state advocacy and policy around that, connecting with the healthcare and hospital industry. But we, of course, see health as more than just healthcare, so do a lot of work with healthy community design. My new colleague, Gabriel Jaramillo, just joined us as the Director of Healthy Community Design to specifically work on strategic initiatives that are place-based, especially around housing and housing affordability and homelessness, healthy local food access, multimodal transportation options, climate change and sustainability. So we're really excited to be building out this portfolio. Many of you have connected with me before in my role overseeing our community capacity building efforts, mostly through technical assistance partnerships, including TAP-AZ, our fiscal sponsorship program. And that has been a really tremendous area that we've been growing in the past 2.5 years since I've joined Vitalyst. I now oversee our transformative grant making portfolio as well, though it definitely is a team effort. So don't be shy about contacting any of our team members who can share more information about that. And of course, our civic health. Sometimes our influence with institutions, including the state capitol or state agencies, city halls, need to be met with some community power building. So we have a whole portfolio area around how we can indeed do that. So that's the 5 program areas that Vitalyst primarily focuses on. But of course, today we're going to talk about our grants. The 2022 Vitalyst grant cycle is actually going to mirror just like last fiscal year's. So if you're not new to Vitalyst or our grants program, not much is new, just the faces. So we have our systems change grant and our Spark grants that we'll talk about today. The systems change grants are meant to support catalytic collaborative work that transforms systems through changes to policies and practices to improve the health for our communities. We'll take a little bit of a deeper dive into what that means. These are 3-year awards ranging from $150,000 to $175,000 total. So that's total for the 3 years, not up to $175,000 each year. So in total. And then we'll take a little bit of a dive into our Spark grants. Not much, again, is changing with this grant cycle, and I'll inform everybody about those efforts in a little bit, but they'll be by invitation only again this year. There are 1-year grant awards up to $20,000, very similar to the systems change grants, but we recognize that sometimes those collaboratives are on their own journey to address systemic change. So they need that 1 year's worth of planning grant to form up that collaborative or that coalition or identify the specific solutions towards systems change. So this isn't to fund an already identified solution as the systems change grants, but to help you start that journey to address systemic change. And again, we'll talk a little bit more about that, and you could check out our website that's linked on that page for a one-pager that talks a little bit more about both of our systems change grants. The grants criteria are again meant for collaboratives working towards systems change. So if you are just one organization, one nonprofit here in Arizona, you already are not qualified. You have to be a collaboration, a coalition of two or more organizations or groups with that lead applicant, the lead organization being an Arizona-based nonprofit serving Arizonans. But we are open to partnering with organizations that are fiscally sponsored. The collaboration has to be led by an Arizona-based organization, and that letter of intent submitted by that lead organization can only submit one application or one letter of intent for the systems change grant. So we see this a lot with larger institutions, especially government entities like cities or municipalities, institutions of higher education that have obviously a lot of departments or divisions, units or whatnot. There has to be one LOI submitted per lead organization. And I'll take a little bit of a deeper dive into this a little bit later when we talk about how we hold an equity lens to our grants. And this is a key piece because we definitely like to see those community partners, community organizations, and stakeholders take the lead in these collaboratives. So one LOI per lead organization. This is meant for systems change and not to be a continuation of an existing program. It really is not funding programs in general. It's more of a project, and we'll take a deeper dive into that as well. You cannot be a current innovation or systems change grantee. So this is now the third or fourth year that we've done the systems change, but if you've been with us for a while, you might remember our innovation grants. And I'm not sure if we actually have any more innovation grantees in our cycles anymore, but if you are a current innovation or a past systems change grantee, you are not eligible to submit a new LOI. However, if you are a previous awardee or partner with a closed out grant, that is definitely okay to apply. Current Spark grant awardees are eligible to apply because it is that kind of two-tiered system. The idea is that if you're not yet ready to apply for the larger systems change grant, you might be qualified for the Spark grant, and then in the next couple of years, better suited for systems change. So we definitely encourage Spark grantees to apply. And then if a Spark grant awardee is selected by the review committee to advance to the full proposal stage, a mid-year assessment will be conducted prior to official invitation to submit a full proposal to assess the progress that has been made. We'll take a little bit of a deeper dive into what this all means and more specific grants criteria. And again, if you have questions, please continue to put them in the chat room. And my colleagues, Melanie, Kelsey, will facilitate those once we take a little bit of a break for questions in just a moment. The timelines for our systems change isn't changing much from last year as well. So it all starts with the letter of intent due at the end of October by 5 p.m. Mountain Standard Time, Arizona. We then go through a review period and have invitation for some of those semifinalists, if you will, to submit full proposals in December. And then those collaboratives have until the end of January, the 28th in 2022, to submit their full proposals. We invite those to also present to our grants review committee. That'll be Valentine's Day week here next year. And then we provide that award notification pending board approval on April 2nd. And then, as I mentioned, the Spark grant is by invitation only, and we'll open that up with invitations in the new year as well, January of 2022. And those proposals will be due in March with award notification later on in May. And you'll see the timeline is staggered because, again, it's meant to be a two-tier grant. If your collaborative is formed and your intervention or solution towards systems change has been identified, you are better suited for the systems change grants, and we'll follow that first timeline. It's an open application, an open invitation to submit letters of intent. But if your coalition or collaborative isn't quite formed or hasn't yet identified that specific intervention or solution towards systems change, you might be better suited for the Spark grant, which again, we'll do by invitation starting in the new year. So let's take a little bit of a deeper dive into the systems change grant. The systems change grant is meant to support a change that is more effective, equitable, and sustainability than existing approaches. It is designed to address one or more of the following things. Certainly to increase the community capacity to identify and address issues affecting community health and well-being. We want to see efforts that are strategically leveraging infrastructure, systems design, and policies to improve health where we live, learn, work, pray, and play, as I said. We are looking for efforts that improve the environmental, social, behavioral, and health infrastructure conditions that impact determinants of health, enable Arizonans to be healthy and resilient. And we want to create a solution that's sustainable to the problem that's being addressed and that endures long after the grant funding. And you see that a lot with systems changes. If it's really tied to specific grant funding and not, then it's probably not a good fit, and the effort towards systems change is just a bit different in that front. With system change, we're hoping to shift the conditions that are holding the problem in place. That's what systems change is, especially those that are permanent shifts in systems change that are more likely to be sustained when working at different levels of change, whether it be explicit, semi-explicit, and implicit. And you can see that a little bit here. So again, as I mentioned, system change is fully sustainable and it's not connected to grant funds or external expectations. It's meant to be organizational or cross systems to implement policies, culture, communication, or practices. You'll hear this a lot. A lot of our past system change grantees have focused on policy or practice changes at many levels of government, whether it be national, state, or local. So this is really important, especially that's fully sustainable and not connected to grant funds or external expectations, because that really differentiates a systems change approach to a more programmatic approach. Again, systems are composed of multiple components that may include people, resources, and services, as well as relationships, values, and perceptions. Systems change is an approach to a social challenge that focuses on these questions. What change is needed? Why is it needed? And what might be the unintended consequences, and how can change be affected? So systems thinking often leads to systems change. Systems thinking is also a sensitivity to the circular nature of the world we live in, an awareness of the role of structure in creating the conditions we face, a recognition that there are powerful laws of systems operating that we are unaware of, realization that there are consequences for actions that we are sometimes oblivious to. To kind of see that visually, this is a great representation from some partners that frame systems change and how it shifts the conditions that are holding the problem in place. You can link to find out more information about this as posted here on the slide. There's a great webinar you can watch on this that better describes the 6 conditions of systems change. And again, you'll see that explicit, semi-explicit, and implicit change, structural, relational, or transformative. And these are the 6 conditions that we really look for and can help guide you as you're thinking, is my idea or project actual systems change? This figure shows the 6 interdependent conditions that typically play significant roles in holding a social or environmental problem in place. So these conditions exist with varying degrees of visibility to players in the system, largely due to, again, how explicit or tangible they are made to most people. And while these conditions can be independently defined, measured, and targeted for change, they are also intertwined and interact with each other. The interaction can be mutually reinforcing. For instance, a change in community and legislator mental models that may trigger a policy change. We've already seen that happen a lot with some of our grantees, which is great. The interaction can be counteracting, for instance, scaling effective practices that may be thwarted by poor relationships coordinated between players in the system. So a lot of coordination between relationships. Since the less explicit conditions are the most challenging to clarify, but can have huge impacts on shifting the systems, change makers must ensure that they pay sufficient attention to the relationships, power dynamics, and especially the underlying mental models, such as racism and gender biases embedded in the systems in which we work. So these system change conditions, again, the policies, these are the government, institutional, and organizational rules, regulations, and priorities that guide the entity's own and others' actions. These policies don't necessarily have to be legislation. They can be regulatory in nature. That practices bucket is, there are activities of institutions, coalitions, networks, and other entities targeted to improving social and environmental progress. Also within the entity, the procedure, guidelines, or informal shared habits that comprise their work. Resource flows is how money, people, knowledge, information, and other assets such as infrastructure are allocated and distributed. Those relationships and connections really is about the quality of connections and communication occurring among the actors in system, especially among those with different histories and viewpoints. The power dynamics is always a fun one. That's the distribution of decision-making, power, authority, and both formal and informal influence among institutions, organizations, and individuals. And then that last piece, the transformative change, is really the shift in that mental model, habitats of thought, deeply held beliefs and assumptions, and often taken for granted ways of operating that influences how we think, what we do, and how we talk. These narratives are shaped by mental models, but narratives also over time shape the mental models we have. So hopefully that'll provide, that provides a great visual into systemic change that is supported through our systems change grants. Sometimes it's hard to see exactly what the system is. And I love this framing as well. Again, linked on this slide, a great PDF that goes a little bit more into what we mean by this. But if you start at the base of this, these are the institutional structures that shape the pathways. These are the incentives, constraints, and opportunities that then shape the pathways, the capacity of entities and organizations, the connections and relationships that they have that then affect individual outcomes. So if you kind of take a back and see the system of things you're helping, it's just another way that supports, that shows what we mean by a systems change. And then one more visual that some of you may have seen from a past Vitalyst presentation is this upstream approach. So that community, where you see the community impact, the strategies around improving community conditions, these are the tactics, the systems change that supports change in laws, policies, and regulations that create community conditions supporting health for all people. So Vitalyst works in this upstream mode. Our systems change grant supports those efforts as well. So I'll take a little pause here to open it up for my colleagues Melanie and Kelsey to ask some questions or to answer questions. Let me stop sharing for a moment and check the questions. I wanted to take a break here because sometimes there are a lot of questions that come with systems change and what that is.
David, for time-wise, we might want to go ahead and keep moving through to make sure that you're able to get through all of the content. If folks will please continue to put those questions in the chat, I am answering them as quickly as they are coming in, and we will also make sure that there will be an FAQ that will be uploaded as a Word document that pulls any of the questions as well as answers that we've provided. There are a couple that have been key ones that have come through Spark Grant invitations. There's additional information on our Spark Grant site on the website. The link is provided. Slides and recording of today's presentation will be provided on our vitalysthealth.org/grants website by Friday this week. National organizations are welcome to provide, they are welcome to be the fiscal sponsor for a local chapter. But the local chapter, the funding and all of the work must be occurring in Arizona. And then a lead versus a non-lead organization question about the number of applicants. The organization may only be the lead applicant on one LOI. We are hard and fast on that rule. You may be a partner on more than one application. So a non-lead partner, you can certainly do that. I see there are questions about examples of grants. I will say about 50% of Vitalyst systems change grants over the 7-year history have been state level policy change. So when we're talking about systems change, we are truly talking about big P legislative level change. About 25% have been local or regional policy change. So they have not required big P policy, but they are implementing a policy or a practice at a regional or local level. And then the last 25% are what got into some of those other levels that David talked about with the upside down triangle of systems change, where you start to see some of the more relational components. There are overview examples of previous grant partners. They're very brief. They're like paragraph summaries. If you scroll all the way down towards the bottom of the Vitalyst Grants page, you'll see previous grantees.
Great, thank you so much for that, Melanie. And we'll talk a little bit more about Spark Grants and then now looking into the more logistical pieces once you've determined, yes, I am working towards systems change, our collaborative is working towards systems change. And as Melanie mentioned, we are capturing all of the questions in the chat room that come up, and we'll compile those into an FAQ that'll be posted as well and shared along, again, with the PowerPoint presentation as a PDF and the recording of this webinar. So let's continue on the journey here. Once you're at the point of, yes, I'm working towards systems change, we have this collaborative, now what? Here, we open up our systems change grant with the submission of a letter of interest or intent, an LOI, that should include these 6 pieces. The first piece, of course, is to ensure that you have that system change potential. And these are questions that our grants review team really focuses on. Who are the different players to include in systems change efforts, and what are the relationships and power dynamics? What are the reasons for the current status quo? What is the readiness or capacity for a system to change? What is the best strategy for influencing systems? How can we learn about what is working and not working to change a system? And is there a clear understanding of the human dynamics? So again, that first concept within your letter of intent, your LOI, should be to note the systems change potential of your collaborative project. That project should also hold the health equity lens. And for us, equity is our work. It's not different work. Equity is a lens through which to view every opportunity, decision, or action. It's how the work is approached. And equity is an approach to determining all strategies, both universal and focused. A lot of folks might have seen different variations of this great visual that shows what equity is. This is an image provided by the Robert Wood Johnson Foundation that shows especially the difference between equality and equity. Equality is giving everybody the same thing, even when they might need something different. So to be able to just be their best person and accomplish what their goals are. Whereas equity is giving folks what they need. Here are some specific questions that our grants review team explore and how you should frame your approach to health equities, identifying or making clear that the people impacted are at the decision-making table. That is a really critical piece that we explore. We also look at what perspectives are being engaged to identify strategies, how those strategies impact different community members or groups. Do you have the experience to know the root cause of the problem? Do the strategies address the root cause of the problem? And will strategies be culturally relevant to the community members groups or groups that you all are trying to serve? So those are a couple of questions that you should review and answer as part of your letter of interest or intent at your LOI. The third thing that we review as part of your LOI are your community partnerships. Again, the primary applicant must be an Arizona-based nonprofit. The partnerships can include incorporated organizations, organized coalitions, and unstructured groups. You should clearly identify your partners, and they should actually be your partners. And the applicant organization plus the partners should have the experience to select the policy or practice change for the identified population. Here are some other key things that we look for as you describe your community partnerships in your LOI, that you're meaningfully engaging your key stakeholders from the beginning. Again, this is a way to hold equity at the center of this work as well. Excuse me, that you're willingly sharing ownership and decision-making among partners, that you're creatively using existing community resources and assets, and collectively practices testing and implementing solutions. Excuse me. The fourth thing that you should definitely hit on during your LOI is the sustainability of the efforts. This really differentiates, again, that this supports a project, not the program, not a program. Mention how the sustainability and the context of the work can be supported beyond the grant if you're awarded, and then how the health outcome addressed by the proposed policy or practice change can be sustained after the grant ends. I know sustainability is thrown out a lot in our sector, but it's really important when you're thinking about systems change, because the total award is $175,000 over a 3-year period. And sometimes systems change takes a long time and beyond that. So noting how your project can be sustained for the long term can help with that. Obviously, we are a health foundation, and the systems change should be working to improve our health outcomes. So your LOI should clearly identify those health outcomes to be improved. Those should be framed in health disparities language if needed. Excuse me. And that is also how you can hold equity at the center of your work as well. This can be done by clearly identifying populations driving and benefiting from this policy and practice change. And you should note different mechanisms for how the policy or practice change is improving the identified health outcome. Here's a great visual to show that. We know if you've worked with Vitalyst before, you know that we work beyond just health as healthcare. There are social determinants of health that factor into a person's ability to live a healthy life. Health is in how you are able to walk or bike in a community, for instance, whether or not you have access to healthy, nutritious foods, if you receive preventative care, and things like having a well-paying job and an education all influence healthy outcomes as well. 80% of these factors are non-medical. You might have seen this be framed as our elements of a healthy community. You can click on the link that's on this slide here, where we dive into each of the spokes of this wheel, as we affectionately call it. It's really important to note here that you should frame your health outcomes. You can frame your health outcomes with the elements of a healthy community, but don't feel you have to touch each of these spokes. and don't force something that's not there. So identify a couple or a few that you know you're working into. And if you need some guidance on this, that link provided is to a great handout that takes a little bit of a deeper dive into each of the spokes of the elements of a healthy community. And then lastly, your LOI should include a high overview of what your budget is. As a reminder, the request should be between $150,000 to $175,000 for a 3-year project. The funding should be consistent with that proposed scope of work. So we definitely see if it's something that is well above that or well below, to see if it's really just consistent. And it doesn't have to be a super comprehensive budget. If you just include a general overview of how the funds will be used, that will suffice. You can include as part of your budget costs for personnel, consultants, travel, convenings, food, evaluation, and some operating and administrative expenses directly related to the project. This is really important because we know that systems change requires a lot of administrative and operation support for the project, and not a program or capital expenditure, as you see here. So we aren't averse to budgets including a heavy administrative budget line item. I will note here, especially for those partners in higher education or universities, that overhead, that university overhead isn't included and is not allowed for our budget. So that is something to keep in mind if the collaborative, the lead applicant is an institution of higher education that often has that administrative fee that is not allowed with our systems change grant. And of course, our efforts for systems change often include impacting policies, trying to influence those. Lobbying is allowed by nonprofit organizations in this sector, though there are certain IRS regulations to determine how substantial that lobbying can be. And it is allowed, but you have to fall within the guidelines and whether how substantial the lobbying is, but it is allowed. There was a question earlier about what are some past or ideal innovations that have been supported by systems change. And as Melanie has outlined, we have some great grantees who have advanced policies in a lot of different ways. Generally, the grants have supported and resulted in policy or practice changes that improve the health of a specific population. A perfect example of this is one of our grantees, Feeding Matters, who worked at the national level with the CDC to implement a new category of a medical billing code that identifies specific infant feeding code that didn't exist before, even though they knew the newborns, infants were being impacted, and the families of those children were being impacted as well. So they were able to narrow that specific population and address that root cause or the barrier to those families and newborns, those children living healthy lives. This is addressing the root causes or barriers is another great example with Feeding Matters. And I love the 5 whys to really get to the root cause. So ask yourself why 5 times, and you should get to the root cause after that time. And if you, the past grantees have had a clear understanding and address the systems change at the intersection of multiple elements of a healthy community. And like I mentioned before, you don't have to have your toe in each of those spokes of the wheel. If you have a couple or a few that you know that you're specifically working in, that's really helpful. And then obviously that health equity lens approach to the work is really critical as well. If you go to the Vitalyst Health Grants webpage, you'll be able to pull up all of our past grantees and get a sense of of their work to see what exactly has been supported in the past, but it has been quite a variety of projects that have been supported. So I'll take a quick pause here to clear my throat even more. Thank you so much for the space and grace on that front. Melanie and Kelsey, are there any questions that we want to answer at this point before we take a deeper dive into the next steps?
There have been a couple of questions, additional questions that have come in. Again, I know the Spark grants are somewhat ambiguous in the sense of they're not quite here yet. They open up in January. That is very intentional. That allows us to go through the systems change LOI process, identify any potential LOIs that would be a better fit for the Spark grant process. I will say that the Spark grant process will still be done by conversations with Vitalyst team members. So utilizing that Calendly link to schedule time. I will ask that if you are only thinking you are considering a Spark grant, so you're not quite at the level of being ready to apply for a systems change grant, please put that request in for a meeting after October 31st. So that way folks who are interested in the systems change process and really need a quick one-on-one conversation can have that time. The tribal wheel, the tribal elements of a healthy community, that's been a partnership between Vitalyst and ITCA and many other wonderful community partners, is completed. We will make sure that that is available to partners on the website as well. So there's one other question that just came in that I have not typed an answer to just yet. The systems change projects cannot be the expansion of existing work. It needs to be tackling a specific systems change, so a policy or a practice change. I will say very candidly, the majority of Vitalyst grants that have been funded are working at that structural change level. So again, that upside down triangle, the majority of them are working at that structural change level. Individual projects, I would definitely encourage you to schedule time, have a chat with David to talk through specifics of your project. If you're thinking you might have a pilot that is ready to dig into something at that systems change level, it just can't be ongoing.
Fantastic. Thank you so much, Melanie. And we will take a little bit of, I keep saying this, a deeper dive into our Spark grants in a little bit. I wanted to really focus on the systems change grant since that'll be the first LOI, but I will get to the Spark grant in a little bit. And as Melanie, also shout out to my colleague Marcus, who stepped into my office to get me a cough drop. We have to take care of ourselves and each other. I appreciate you, Marcus. Yes, let's continue the show here. As Melanie mentioned, the next steps, once you're like, yes, we have that collaborative working towards systems change, and we feel we can put together a solid LOI, what do you do from here? You can have a conversation with Vitalyst staff. As I mentioned, it's a team effort for our grants, and while I'm directing them, you are more than welcome to connect with another staff member. And if you've already been working with them, please can you continue to do so. You don't need additional meetings. A meeting is not required, but this is one way we practice our values of openness and transparency. We would rather have an introduction conversation with you to really hear more about your idea and your collaborative to see if it's a good fit for system change early on and before you begin drafting your LOI or submitting an LOI, so that your time isn't wasted. If you do want to have a conversation, happy to do so. My Calendly link is set up there, and it's also posted on our Vitalyst Grants website as well. These meetings are about 30 minutes long, and you should come to that meeting prepared to discuss a thoughtful idea. It's not really too much of a brainstorm session between you and me, although those are really fun. You should really have that collaborative idea already framed to have that discussion. Again, you don't have to have that meeting to be able to begin drafting and submitting an LOI. And here are some concepts to include as part of that. The alignment with Vitalyst mission is really critical, and really making sure that your LOI is clear on those 6 components, like the policy or practice change that you're working on to improve community health. There's a framing of the elements of a healthy community you can list on, and just being really clear with the system that you are proposing to change. That health equity approach is also super important to include in your LOI. And again, you can refer to those equity slides that identify some specific questions that we ask as reviewers. The community partnerships, really critical again. Melanie hit on some of those questions. 2 or plus organizations that are in a formed collaborative, a project that is sustainable beyond just this grant funding, and those clear health outcomes. And very briefly, again, an outline of your project budget between $150,000 and $175,000 that again matches the scope of work that you're including in your LOI. So again, be specific as possible and use your LOI as kind of this initial stepping stone that might be that can help frame up a larger application if you're invited to submit that. From the conversations that you have with Vitalyst staff or me, use that feedback to guide your LOI. And again, there's only 1 LOI per lead organization. Those are due at the end of October, the 29th of October by 5 p.m. Arizona time. And you can submit through that online portal that's linked on this slide. That'll again be posted on the Vitalyst webpage. And then you'll be notified by December 10th of an invitation to apply for the full proposal. And in a little bit, I'll take a deeper dive into the submission instructions as well. Like now, once you are ready to submit your LOI, you can follow the instructions outlined online. It's linked here and again posted to the Vitalyst Health Grants webpage. Your LOI should be no longer than 2 pages. Keep it simple but clear. It should be typed in single space with a minimum of 12-point font. Those are some preferred fonts that we use. And then I know that's a lot of material to fit into 2 pages, but if you can keep those 1-inch margins, that would be greatly appreciated. And then we accept a variety of different file types. Your LOI is submitted through our grants management system called WiseHive. And here's some instructions on how to submit your LOI. Again, that PDF has all of this information, but you go to that website and this page pops up where you can create a new account. That should be your first step. If you're an existing applicant or partner, you might have an account already. And you'll from there, after creating an account, create a profile. This is really critical step because as an organization, we've begun to collect additional information from our applicants and our partners, our grantees, to hold a health equity lens ourselves. So you'll see some additional questions with regard to diversity, equity, and inclusion, some geographic and demographic information. Once you have created create an account and a profile in the grants management system, you'll be ready to submit your LOI, which you can see the screenshot of this. And again, this is detailed in that the PDF on how to submit a grant or an LOI. And then once you're confirmed with this, you'll receive a confirmation email. And again, this is the timeline. So the LOIs are due by October 29th by 5 p.m. Arizona time. Our grants review team here at Vitalyst spends most of November reviewing those and then selecting those that will be invited to submit a full proposal by December 9th. The full proposals of those semifinalists, if you will be due on January 28th at 5 p.m. Arizona time. And then those proposals, those collaboratives are invited to present usually in person, but probably still virtually in our state of the world today, that week of February 4th through the 17th. And then we go through our grants review process, both internally and with our board of trustees throughout the remaining March. And the decision is made by our board, and awardees are notified on April 2nd. So I think we're coming upon the top of the hour. So if you have continued questions, please continue to put them in the chat Zoom room. Thank you again to my colleagues, Melanie and Kelsey, that are responding to those. And again, we'll be transcribing all of those and the answers in a FAQ that'll be posted to the website. But really quickly, I wanted to take a deeper dive into our Spark grants. Again, they're still meant for collaboratives working towards systems change, but maybe that organization or the coalition aren't completely developed. So we'll support that with 1 year's worth of funding between $10,000 and $20,000. And again, just like last year, our Spark grant cycle will be by invitation only this year. We learn more about those potentials through the systems change LOI process. If we determine as part of our review process that collaborative or coalition isn't quite yet ready for systems change, we'll invite them to apply for the Spark grant. And of course, we have several conversations with staff to see of potential Spark grant applicants even outside of the systems change LOI process. And those folks will be notified by Vitalyst staff in January of 2022 on the 28th. And we'll have a couple months to compile their applications to submit by Friday, March 25th. The Spark grant is a little bit different than systems change grant. As we've been talking about, we really look at how ready the organization or coalition, the collaborative is, and what their capacity is for the partnership. We ask, how is the project approaching the work through an equity lens? Sometimes that piece is really missing from systems change LOI submissions. We ask ourselves, how will the project make a significant sustainable difference in the future? Of course, Spark grants are still shooting for systems change, so they are a focus on that still. And then we want to see that the project address the intersections of multiple spokes of the elements of a healthy community wheel. So basically the same general criteria for the systems change, but that collaborative or coalition just needs a little bit more support to form up and identify their specific intervention or solution towards systems change. And then one more slide. For all of our grantees, there is engagement after funding. So once we make the decision of who is awarded both the systems change and the Spark grants, we don't just write the check and let you go on your merry way. We want to stay engaged with you and actually host quarterly learning sessions with all of our grantees to help continue to build your capacity and provide technical assistance for your collaboratives and coalitions. All grantees are encouraged to apply, and our sessions are again held virtually, still with the nature of things, quarterly, usually on Friday mornings. And the topics that are included in those learning sessions are on a variety of topics based on the needs that we're hearing of our grantees. And then the reporting for our grantees is semi-annual based on the outcomes and updates on budgets and lessons learned. And we're definitely open to staying connected even beyond that. And even before you submit an LOI. So again, we have a strong value of being open and accessible. So if you have any questions or want to have a conversation about your idea, your collaborative, don't hesitate to reach out to me. That's my email address. And again, if you go to the Vitalyst Health Grants webpage, that's linked there, you'll be able to schedule directly with me a 30-minute time in the next couple months via a Calendly. So let me stop sharing there and just open it up not really quickly, but just open it up to my colleagues, Melanie and Kelsey, to see if there were any new questions that we can address now. But again, we'll type up the questions and answers in an FAQ that'll be posted later with this recording.
Hey, David, I think the only other additional question that's come through is are 501c4 organizations eligible to be a partner? And yes, they are eligible to be a partner. They would not be eligible to be the lead, but they are eligible to be a partner. And then there was a question about how many systems change grants we fund. So typically we fund 3 systems change grants each year. That can fluctuate related to our funding, but 3 is our typical number. And then Spark grants, we typically fund 10 grants per year. I think that's the main ones that have come through.
Fantastic. Thank you so much, Melanie and Kelsey, for facilitating the Q&A in the chat Zoom room. Again, we'll type up those questions and the answers and any other ones that need explanation, additional resources that will help in your drafting or consideration of drafting for an LOI. And again, we're really excited to open this up and be open to conversations about your collaboratives and your project ideas. So please go to vitalysthealth.org/grants to learn more and to schedule time to chat with me or any other member of our Vitalyst team. Thank you all so much for spending time with us today, and we can't wait to review your LOIs. Continue to be safe and healthy. Take care of each other and ourselves.